Hi, I'm Dr. Michelle Hayes,
I'm Dr. Kristen Lassiter,
and we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
meaning mental health in relation to reproductive hormone changes like around pregnancy, postpartum menopause, premenstrual disorders, and infertility.
Today, we are going to be talking about utilizing a medication called Bupropion, or the brand name here in America is either Wellbutrin or Forfido, or I think there's another one. It's also in Contrave, which is a combination medication. We're going to be talking about that during pregnancy and the known risks and benefits of that medication. Okay, so let's first start with the fertility, where we kind of go stepwise, right? Like, so fertility, no research.
No studies looking at whether or not this medication impacts fertility.
Moving on.
Next.
Okay, also, I do want to give a caveat because this medication can also be used for stopping smoking, or like we use a fancy term called smoking cessation. So we don't have a lot of data, just right.
Yes, there's this. Yeah, I'd say out of like a lot, or more commonly used antidepressants, this one there's not as much research.
Right. And also to add that because this medication is used for something else, it can really muddy the waters when we're looking at kind of teasing out the risks. And if we see something in a study, is it because someone was still smoking, or was it because someone carried the risk of depression, or it can be used for ADHD. So it kind of muddies the water. So if we were to say this medication is only used for one thing, then we would be able to say maybe three groups. Someone who had no risk factors, someone who had a completely healthy, normal pregnancy, someone who had the illness we were treating for, and someone who had the illness we were treating for and was taking that medication. We kind of tease out where all of the risks come from, right? But since we're throwing in lots of other extra factors in here, we have to kind of give a little asterisk on everything, because sometimes we can't tease out whether maybe it was smoking, or maybe some other risk factor that leads people to be smoking, or maybe something else. So I think it's always an asterisk when we talk about increased risk. The studies are kind of muddy.
Because we know that depression, for example, can increase the risk of different things happening during the pregnancy and to the baby. So we see that it increases the risk of baby being smaller for gestational age. It increases the risk of premature birth, which increases the risk of other neonatal complications and even neonatal death. It also increases the risk of baby having more issues with behavior and emotional dysregulation. So basically to say that illnesses that we're using this medication to treat are also not benign to a pregnancy.
Right, they are risky.
Right.
Yes. Okay, so getting into it, we're looking at bupropion during pregnancy. We basically have 7 clear studies. We have 7 studies, and that for 5 of those studies, they did not find any increased risk of birth defects or malformations. 2 of those studies did find an increased risk of cardiac or heart issues or malformations related to bupropion used during pregnancy. Again, they were not able to kind of tease out whether that might have been related to smoking, the indication it was being used for, or the medication itself.
Or depression, for that matter.
But I think overall, the majority of the studies do not support that it would cause birth defects itself.
And then similarly with miscarriage, it's kind of been a little bit mixed, and then the very few studies we have, some show maybe it can increase the risk. But again, when they went back and looked at teasing out people with depression versus healthy controls and looking at the medication's risk there, it didn't increase the risk of miscarriage compared to people with depression and pregnancy.
And also, I will comment that the authors of the studies that said, okay, there might be an increased risk of miscarriage, looked at the control group for that study, which is the group that wasn't taking anything, and they just kind of monitored to see what was happening. Their risk of miscarriage was abnormally low in that study for we don't know what reason, and that the risk of miscarriage related to people who were taking bupropion during their pregnancy actually matched what would generally be found in the population. So they're not really sure why that happened, but I just want to add that caveat because weird things happen in studies and they did find an increased risk, but when they looked at the bigger picture, they actually didn't find that information. So.
Yeah, and that just kind of goes along with the fact that we never look or put much weight on one particular study. That's why we're also emphasizing that there's not a lot of studies on bupropion, because we really need a lot of studies and repeated research to kind of back up what other studies have or have not found.
That's a good way of saying it. Perfect. Okay, so then we would talk about pregnancy complications, like birth weight, length, head circumference, how well the baby does when they're born, and we have not found any differences. Also, caveat, there's not that much information about that.
Yeah, I think there's just one study on it.
Right.
So we don't really know.
Okay. And additionally, one study showed that, we know with the antidepressant class of medications that there is an increased risk of what's called neonatal adaptation syndrome, which is the baby having a little bit of difficulty adjusting to life out of the uterus, that there is an increased risk of neonatal adaptation syndrome for babies born to moms who were on bupropion, but that risk is actually lower than the risks that we have with other medications that are used to treat the same things.
Yeah, with other antidepressants. But I will also say that neonatal adaptation syndrome in general only happens in about 25 to 30% of babies who are exposed to antidepressants during pregnancy, and it is a time-limited condition. So usually by 1 to 2 weeks, it's resolved, and there's no long-term effects from it.
Yeah, and I just tell my patients, the vast majority of people, their treatment is snuggle. So overall, it's not as scary as it sounds.
Yeah.
Or you give it this big fancy long name, and it's not as scary as it sounds. Okay, so I do think one thing to talk about is developmental outcomes for children born to moms who are on this medication during their pregnancy. And we don't have any solid data to support one way or the other, except that there may be an association with taking this medicine in pregnancy and the child having ADHD. I will give the caveat here that we use bupropion during pregnancy or at other times to treat ADHD, and ADHD is very, very heritable, meaning if your parents have it, you're likely to have it. If you have it, you're likely to give it to your kids.
So again, we can't tease out, did these children have an increased risk of ADHD because their parents have ADHD? That's why the medication was being used, or is it because of the medication?
Yeah.
And I will say, out of, just kind of as a caveat, out of all the treatments that we do have for ADHD, especially the more stimulating type medications, this one has the most amount of research for use in pregnancy.
You can tell that this is a very nuanced conversation. We talk about the illness that we're treating. We talk about the medication. We talk about people's individual risks. So if this is something that you're considering or currently taking, definitely talk to your doctor, because you're going to have a lot to talk about that's very specific to you. But if this is just you're trying to gather information, we definitely view bupropion as a reasonable choice during pregnancy, all things considered.
Yes.
Yeah. Thank you so much for being here. Please like, comment, subscribe. We'll see you soon.
Bye.